How do you treat older lips? If you take a pretty 25-year-old, the swelling alone makes them look better. Let's be honest. It's quite easy making someone who's quite pretty, very pretty, by adding a little bit of lip volume and a little bit of contrast with the color. But as soon as you try to apply those same techniques to older people, you realize this is hard. It also needs a much more in-depth consultation. So how do I think about this situation generally? It's worth thinking always with all your clients that there are actually three different diagnoses we're trying to make. We've got the psychology of the patient, the aesthetics of the patient, and then the anatomical situation that is driving those two factors above. And we need to break this down in the consultation. Now, what often happens with this is they start to request the wrong treatment out of fear because they don't want their lips done. And what this means is that you end up with isolated treatments, because if you're trying to treat upper lip lines, for example, and you don't treat the body of the lip, you get that Homer Simpson look eventually. Joe! And this unfortunately happens to people who don't want to be overtreated, is that they end up treating just the lines, and this then changes the overall shape of their face, and they look treated in a different way. So we must avoid the Homer Simpson mouth, and the way to do that is with a good consultation that makes sure that your patient is educated and informed on what the aesthetics are made up of and how your injection technique will protect them from looking like a trout pout, that will also make them look younger, which is obviously what they're looking for. So let's think about the aesthetic diagnosis next. What do you see with aging lips? A lot of this, I believe, is down to the emotion that our faces trigger when we look at ourselves in the mirror as we age, and that's often why patients present. So that negative emotion is caused by two main factors. There's the anger element, which can happen because lips look smaller relative to the rest of the face. They also may have lines on them, which also creates that sense of pursing, which is associated with negativity or anger. And then there's the sadness that may come from a downturned mouth. So the next diagnosis we need to make is the anatomy. So what is actually causing these aesthetic changes? The lips themselves obviously are losing volume. That's the primary thing, and it starts in your early 30s. And next, after that, you start to lose some of the integrity that goes with that. So that's decreased collagen. And in some cases, you actually get hypertrophic skin, which makes a different type of aging. But both of those will appear in different patients, and it's worth spotting which is which, because that might change what you can do. So lost or increased volume elsewhere also impacts the mouth. As we've discussed already, the lost volume underneath, but also think about teeth and bone loss that is associated when you lose teeth. All of this can cause an involution of the lips. And then you also get hypermobility with the fat pad loss that happens. So this is that hypermobile mouth, the high degree of pursing that happens when you've lost the fat pads around the mouth. And all of this is allowing muscles to dominate the face and cause many more lines than if they were resisted by appropriate amounts of fat. So holistic structure first. Is there a downturn or a negative shape? So I always think about the overall structure of the mouth as number one. And when you're assessing the mouth, think about the chin and the jowls and the resting pursed lips, which also all point to fat pads which are depleted or hypertrophied and could be supported or reinflated depending on whether it is a fat pad that's resting from the side or just that it's lacking volume from within the structure. So this is where your lip treatment turns into an overall face treatment. And if you're good at consulting, that will happen quite often. But obviously we're going to focus also on directly treating the lip. So if you're going to focus on lip restoration on its own and not think about the rest of the face for now, there are three key zones to understand. You've got the lip structure, and I always think of that as if you were to draw a lip, what would be the first thing that you draw? You draw the vermilion border and the curves and the shapes. And that's really where I start looking first. What is the overall shape of this mouth? Is it downturned? Does it have the important details? If I was to start injecting, I would normally start correcting structure first. The next thing I'd think about is the volume. And what does this look like? It's the curvatures, the projections, the relative proportions all link a little bit more back to volume. And those are usually different injections as well. And then finally, where most people start is actually the last thing I think about, which is lines and wrinkles. Once you've got the structure and the volume, treating lines and wrinkles is a lot easier, and you don't end up causing a disproportionate result by focusing on a superficial line and then adding volume that changes the shape of the lip in a way you wouldn't want to. So we start with the underlying structures and then finally do lines and wrinkles. So where can you inject if you think about it this way? There are essentially three zones you could think about. You've got the lip body. That's the main part of the lip that we treat in most younger people where you're adding volume. You then have the retroorbicularis oris fat pad, which depletes as most people get older. It's not a common place to treat, but it's one of the reasons why people get really severe lines sometimes, is that they've lost so much volume in their mouth that the orbicularis oris is very dominant, and it causes many, many lines while they're just sitting, resting, doing nothing. And that's often the fat pad underneath, which you can treat as well. And then you also have the hypodermic fat above the muscle. Included in the lip body, by the way, I'm also including the defining point. So the vermilion border, you would also treat alongside that. But the hypodermic fat where the lines are is another place that you would commonly treat if you're trying to restore a lip. This is not a tutorial on how to do this whole procedure, but a brief description on the different techniques that you might use. So if you were to try and structure a mouth first, and you decide that this patient has a lot of lost fat underneath their orbicularis oris muscle, you can replace the volume underneath that area. You can do it, I recommend, with a cannula, because as we know from previous lectures I've done on this, the arteries tend to be underneath the muscle. So if you're going to replace volume underneath the muscle, let's do it with a cannula. That makes it much safer. You can enter, some people enter through the philtrum, some people enter at the modiolus and try and slide underneath. And you're basically just painting a little thin layer of product. I would recommend that you feel underneath and make sure it's smooth from the inside too. And do it slowly, little passes, a little bit of volume. Test their movement as you're going to see how it resists the movement of their skin. And that can be a good base layer in a patient wanting a really good result. The next thing you might want to treat is the lip body. I think in practice, I'd probably treat the lip body before I treated the retroorbicularis oris fat pad. But the lip body is vital if you want to get a natural result in an older person with very small lips. And it's often the component that they resist treating because they're afraid of looking done. So they say, don't treat my lips. A good consultation should win them round, and with small volumes, just adding enough to give a bit of roundness back, showing a little bit of pink in their lip, it can really make them happy. And that's a good place to start, so that you're turning back the aging process, which tends to cause the lip to rotate inwards, so that you're rotating it slightly outwards. Might be appropriate to do some of that just with a cannula to decrease the level of bruising and trauma, or just small amounts in the anterior surface of the lip with a needle. Finally, once you've done those elements, you might start tackling the lines. So I quite like using, if lines are really bad and I'm replacing volume in the hypodermis, I like to use a cannula because it's low trauma. This area is very painful to treat. It's likely to bruise as well because the number of lines means you're going to use a lot of needles to go in. So I've taken to using a very soft product, something like Juvederm Volbella, and just painting a thin layer of product underneath it within the hypodermis above the muscle, and just seeing how that softens the lines a little bit before I go after the deeper lines by injecting within the dermis with the needle. And that's usually the final stage. So I should have a nice solid platform to then restore the lines themselves. And that is very superficial injections. You're often just in the mid dermis, but it's not very thick skin, and just doing little tiny microboluses in the lines, little tiny 0.0025. It's really, really small amounts. Your needle's hardly moving, and you're just hoping to see that line slightly unfold, and then you can move up to 2 or 3 within each line. Very low volume so that you're not risking changing the structure, and using a product that's also suitable for that area. So Juvederm Volbella, once again, is a good product to use in those areas. So that is my general approach for trying to get the best possible result. Now, do remember, really, I hope you take home from this that you don't have to aim for perfection with all your older clients. A step in the right direction can be all they need to feel amazing, and it is the psychology that we're after. So that's my overall view of lip treatments for older people. I'd like to know what you think about it. Has this helped you in any way? Will you feel a bit more confident about what to say to your next client? Let us know in the comments down below.